Hi guys, welcome back. We shall talk about glaucoma, very important one. Glaucoma is the second most common cause of blindness in the world. That is glaucoma. First most commonest cause of blindness in the world is cataract. Okay? So this is a small question type. Okay, so before we start of glaucoma, we should know how do we diagnose glaucoma. Diagnosis of glaucoma will include 3 points. Okay, out of these 3 points, at least 2 has to be positive, 2 or more. Okay, if 2 are present, we say it glaucoma. If 3 is present, we say it glaucoma. But if 1 is present, we cannot say it is glaucoma. So increase intraocular pressure. Okay, the increased intraocular pressure, the normal intraocular pressure is 10 to 21 mm of Hg. Okay, with this we have the optic disc damage. Okay, with this we have visual field defect. Okay, the normal is superior is 60 degrees, nasal is again 60 degrees, we have the inferior 70 degrees, and temporal is 100 degrees. Okay, so these are the 3 parameters. Okay, out of these 3 parameters, if 2 are present, we say glaucoma. If 3 are present, we say glaucoma. But if just 1 is present, we cannot say glaucoma. Okay, so if a case says only intraocular pressure is increased and both of these 2 are normal, it is not glaucoma. Okay, that can be due to some other reason, but not glaucoma. Okay, so why intraocular pressure we are so worried? Intraocular pressure increase, what will happen? Intraocular pressure will increase, that means pressure will increase, right? Pressure increase means what? This pressure will go and press the optic nerve. Optic nerve is pressed, what will happen? This optic nerve will go to damage. Okay, now this optic nerve is damaged, this means what? That means visual field defect will happen. So intraocular pressure increase, pressures increase, optic nerve is damaged, that means the visual field defect will be manifested. Okay, this is the normal value that you should remember. Then now we have another question, that which is the type of neuron that has been damaged in the retina. Okay, which is the type of neuron that has been damaged in retina? We have actually 5 types of neuron in retina, but what we are mainly focused in this is ganglionic cells. Okay, the type of cell that has been damaged of the neuron of the retina is ganglionic cells. Okay, I have a photo about this thing. We have the ganglionic cells, we have the amacrine cells, we have the bipolar cells, we have the horizontal cells. Okay, and with the Rods and cone. Out of this, we are affecting the ganglionic cells. Okay, these ganglionic cells have been affected in glaucoma. Okay, so now once we do it, now we shall go and see the classification of glaucoma. Okay, the classification of glaucoma is, first is very easy. First is primary and secondary. Now this primary means we don't know the reason. Why is the cause of glaucoma? We don't know the reason, then we will say it's primary glaucoma. No reason known. We know the reason. Okay, we know the reason. Now what can be the new reason? This can be the lens induced. Now how lens induced? If the lens is actually absorbing water, this lens will become thicker and it will press the angle. And then if we have trauma means again inflammation means again the angle will be closed. And we have uveitis. Okay, we have neovascular. Neovascular means blood vessels. So what is this angle that I'm talking about? Okay, this is very important that we shall understand this. So again, come back to the photo. So this is the lens. Okay, this is the cornea, and then we have the iris. Actually, cornea is the most transparent part of the human body, and we never see the color of cornea, we always see the color of iris. We say a very tender habit, no, what is the color of your eye? That is, we are seeing the color of iris. Cornea will never have the color. Okay, cornea is 100% transparent. Okay, so let us try to understand. This is the iris. Okay, so the eye has been divided into anterior segment and posterior segment. Again, this anterior segment is divided into anterior chamber and a posterior chamber. Okay, so what is anterior chamber? This structure which is behind the back part of this cornea, okay, and in front of the iris is known as the anterior chamber. Okay, this part is anterior chamber. Now posterior chamber is behind the iris and in front of the lens is known as posterior chamber. Okay, and anterior chamber and posterior chamber, both they form together is known as anterior segment. That is the structure which are present in front of the lens. Now what is posterior segment? Structure which are behind the lens, okay, is known as posterior segment. The structures are vitreous humour, we have the retina, we have choroid, and we have the optic disc. Oh yeah, so whenever how is this aqueous humour drainage is very, very important that we should understand. The aqueous humour drainage is formed in the ciliary body, then it goes here, it goes from the posterior chamber, comes out by the pupil, okay, then it comes to the anterior chamber and then slowly goes to the angle. This is the angle, okay, the cornea and the iris, this is the angle. Here in angle we have something known as trabecular meshwork. In very simple words, just imagine it's like a drainage pathway, okay. So this aqueous humour is produced here, it comes out like this and this. Okay, so in any cases, if this iris is been pushed forward, let's say the iris is collapsed and it gets stuck here, okay. So what we see, this iris sometimes getting stuck to the corner, we see it in anterior synechia. It's very, very common in uveitis, okay. In anterior uveitis, we see it. What happens, this angle is closed, so obviously this aqueous humour cannot go out, and if imagine this lens is absorbing a lot of water and it's becoming thicker, becoming swollen up, obviously it will press the iris forward and this angle will be gone, okay. So that is what we should understand here. And sometimes even this angle is open, still we see the intraocular pressure is going up, okay. That is known as open angle glaucoma, and if this angle is closed, it's called as angle closure glaucoma, okay. Sometimes even if the intraocular pressure is same, still we have glaucoma, that is known as normal tensive glaucoma, okay. So once we do it, so wait a second, okay, sorry, because of my battery. Okay, so primary and secondary, okay. So let us try to divide primary glaucoma. Again, this is very, very important. We divide primary glaucoma into childhood, adult. Now this adult is divided again into open angle glaucoma, closed angle glaucoma. Okay, and in childhood we divide it again congenital and juvenile. Point where we should give more attention here is that the age is very, very important. From birth till 3 years, this 3 years is very important, and in the juvenile we say from 3 to 40 years. Okay, so why we are so much focused about 3 years? That till 3 years the eyeball is very, very flexible. Even if the intraocular pressure is going up, this eyeball is able to adapt. Okay, it is able to adapt due to it is getting stretched out. Since it is getting stretched out, this eyeball will look very big. Okay, we also call this congenital glaucoma, as also we call it as bullseye. Okay, the eye of a bull is very big. That is the reason we say it bullseye. In juvenile, from 3 years to 40 years, okay, that is the age group, and the adult is open angle glaucoma and closed angle glaucoma. So this year, the age is again important. I again want to focus on this age. Okay, so that is what we are trying to see, and to know it is open angle glaucoma or closed angle glaucoma, we need to see the angle. Okay, how do we see the angle? We use an instrument known as gonioscope. Okay, we need to use an instrument known as gonioscope. Gonio means angle, scope means instrument. Okay, so again, basic summarizing glaucoma. The most common cause of blindness in the world is cataract. The second most common cause of blindness in the world is glaucoma. To diagnose glaucoma, we need to have minimum 3. To diagnose 3 points has to be there. Out of these 3, at least 2 has to be there. Okay, intraocular pressure has to be increased, optic disc damage has to be there, or visual field defect has to be there. Out of these 3 points, minimum 2 has to be there to say it as a glaucoma. Okay, so why intraocular pressure increase? Intraocular pressure increase, that means it will put pressure on the optic nerve. Optic nerve, it will put pressure onto the, it will cause damage to the optic nerve, and then slowly it will damage the visual field. Defects will be appreciated. Now Again, the glaucoma has been divided into primary and secondary. Primary means we don't know the reason why there is glaucoma, and secondary we know the reason why there is glaucoma. Okay, in secondary we have lens-induced, traumatic, uveitis, neovascular type. Okay, and the primary again is divided into childhood and adult. And in uveitis, the most damage, the most maximum uveitis that is causing you the glaucoma is anterior uveitis. Okay, maximum is anterior uveitis. Okay, why anterior uveitis is mostly doing most damage is that due to in anterior uveitis we are using steroids, and steroids is itself known to cause you glaucoma. That is steroid induced glaucoma. Along with this, okay, there are a lot of blood vessels are getting involved and inflamed, and a lot of neutrophil and eosinophil, basophil, all this stuff are getting accumulated, and it is going in actually blocking the trabecular meshwork. So these are the two mechanisms why anterior uveitis has the maximum, it causes the maximum amount of glaucoma. Okay, and so I hope you understand what is this. This is the cornea, we have the ciliary body here, we have the lens somewhat here, we have the zonules. Okay, this is zonule, this is the angle. So what is happening in anterior uveitis? So if we have a known condition known as anterior synechia. So what is anterior synechia means? The iris is going and attaching to the cornea. Okay, if this iris goes and attached to this, obviously this angle has been blocked. So this is anterior synechia. So obviously this angle has been blocked. Okay, so that is the reason the maximum amount of glaucoma is seen in the anterior uveitis. Obviously we can see in another uveitis as well, but the maximum is done in anterior uveitis. And in childhood and adult, we have congenital and juvenile. The age is very, very important to 0 to 3 years. 3 years because till that age, the eyeball is very flexible and it can adapt to the situation, and it can slowly increase in size. That's why we see a very big eye, also known as bullseye. And juvenile is known as from 3 to 40 years of age. And we have the adult glaucoma. There's open angle glaucoma and the closed angle glaucoma. And to identify the angle is open or closed, we use an instrument known as gonioscope. Gonio means angle, scope means to instrument to see, and that is what about this. Now we shall talk about the congenital glaucoma. Thanks.